Hey everyone, this is Paul from Ortho Eval. I want to talk about Greater Trochanteric Bursitis today. Now, a lot of people have pain on the outside of the hip right here. There are many things that can cause pain to the outside of the hip, such as a herniated disc or pain in this muscle down here called the IT band, and other types of injuries. But today I want to talk about bursitis. And what is bursitis? Well, on the outside of the hip, there is this fluid-filled sac that sits right over the bone near the tendon, and on occasion that sac can get inflamed and irritated. Now, there are a couple different ways we can identify if this is a bursitis versus a muscle tear. Generally, these are tender to touch, and without exposing all of her skin, you can maybe see here there's quite a ridge. She has quite a bone spur on this area, okay? And she's also exquisitely tender to touch, right there, okay? And so one way to rule out the muscle to see if she has a muscle tear or a tendon tear here of her glute medius is to kind of push her ahead a little bit. We're gonna take this leg, we're gonna lift it out to the side, and we're gonna have her hold it there. Does that hurt? No?
No.
Okay, and try to hold me. Don't let me push it down. Give her some resistance. Now, she doesn't have any increased pain with that. Now, it is a little bit weak, but this is mostly irritation to this bursa. Now, we see this often with people who have a flat foot, pes planus type foot deformity, or somebody with a leg length discrepancy. And she happens to have a leg length discrepancy in the right leg. Is about a 1/2 inch to 3/4 of an inch longer than the left leg. And that is quite common with bursitis of the hip. So what we're going to do is we're going to manage this with some modalities like iontophoresis with dexamethasone to decrease that inflammation, because it's so close to the skin and that bone is sticking right out there and that bursa is very well exposed. We're also going to do some light strengthening of her glute musculature, and we're also going to put a lift on that left side and try to improve her gait some so she doesn't overstress the tissues on the outside of this hip. So that is Greater Trochanteric Bursitis, one of the biggest causes of pain on the outside of the hip, and how to differentiate that between the bursitis and a glute medius tendon issue. Now, if you like today's video, give us a thumbs up and be sure to subscribe. Thanks.